এয়া আকাশবাণী ডিব্ৰুগড়। আগবঢ়োৱা হৈছে ডাক্তৰ অৰুন্ধতী তামুলীৰ কথিকা অবজাৰভেন্স অফ ৱৰ্ল্ড গ্ল'কামা উইক।
Hello everyone, I'm Dr. Arundhati speaking from Renu Eye Care Center, Dibrugarh. This week we are observing Glaucoma Awareness Week across the whole world. At our center, we are also conducting a public awareness campaign. The motto of this campaign is Uniting for a World Without Glaucoma. Just take a moment and think about that phrase, a world without glaucoma. It may sound like a big dream, but in reality, much of the blindness caused by glaucoma can actually be prevented. If people are aware of the disease and if they get their eye checked in time. And that is exactly why we are having this conversation today. Let me start with a small incident that happened recently. A few days ago, I met one of my old school friends. During our conversation, something made me suspect that she might have glaucoma. So I asked her a simple question. I asked, "Does anyone in your family have glaucoma?" She immediately replied with another question. She asked, "What is glaucoma?" That moment made me pause and think. If someone I studied with, someone educated, unaware, doesn't know what glaucoma is, then how many people around us might also be unaware of this disease? And if people do not know about glaucoma, how will they ever think of getting their eyes tested for it? So today, let us talk about glaucoma in a very simple way. Inside our eyes, there is a very important structure which we call it optic nerve. You can imagine the optic nerve as a cable connecting the eye to the brain. When lights enter the eye converts it into a signals and send those signals to the brain through this optic nerve. Only then does the brain create the image what we see. So in a way, this nerve is like a communication line between the eye and the brain. Now imagine what would happen if this communication cable slowly starts getting damaged. This is exactly what happens in glaucoma. In glaucoma, the optic nerve gradually gets damaged over a period of time. As the damage progresses, vision slowly starts disappearing. And the most worrying part is this. The vision that is lost due to glaucoma cannot be brought back. It is irreversible. It is permanent. Now let me ask you something. When we have tooth pain, we immediately notice it. When we have a headache, we feel it instantly. But what if a disease is damaging your eyes without causing any pain or warning signs? Would you even realize it? This is the danger of glaucoma. In the early stages, glaucoma usually causes no pain and no obvious symptoms. Many people, they continue their daily activities normally, reading, watching television, using their phones, without realizing that something serious may be happening to their eyes. That is why glaucoma is often called silent thief of a sight. It quietly steals vision. Usually the first part of vision to be affected is the side vision, also known as peripheral vision. But because we mainly use our central vision for reading and focusing, people may not notice this change. By the time someone realizes that their vision is shrinking or becoming tunnel-like, significant damage may already have occurred. And at that point, we can only try to prevent further damage, not restore what is already lost. Now I would like you to pause for a moment and ask yourself a few questions. When was the last time you had your eye pressure checked? Have you ever had your optic nerve examined by an eye specialist or an ophthalmologist? Does anyone in your family have glaucoma? Many people listening right now may realize that they have never thought about these questions before, and that is perfectly understandable. Glaucoma is not something people usually think about in their daily lives, but perhaps today is a good day to start thinking about it. For many years, glaucoma was believed to occur mainly because of high pressure inside the eye. Our eyes contain a clear fluid that circulates continuously. If this fluid doesn't drain properly, the pressure inside the eyes may increase. This pressure is called intraocular pressure or simply eye pressure. Normally, eye pressure lies roughly between 10 and 20 millimeter of mercury. Earlier, doctors thought glaucoma was mainly a disease of high eye pressure, but modern research has taught us something interesting. Glaucoma can also occur even when the eye pressure is normal. This condition is called normal tension glaucoma, and studies suggest that it may account for nearly one third of glaucoma cases. So the disease is more complex than we once believed. This is why glaucoma cannot always be detected by symptoms alone. It requires proper examination by an eye specialist. Now let us look at another important question. How common is glaucoma? If we gather 100 adults from the community, research suggests that one or two of them may have glaucoma. Now imagine a gathering of 500 people, or imagine the population of an entire town. Among them, there'll definitely be some people with glaucoma, many of whom may not even know it. In fact, in many parts of the world, almost half of glaucoma patients are unaware that they have the disease. That means they are silently losing vision. But here is the good news. If glaucoma is detected early, we can usually prevent severe vision loss. Today we have many effective treatments. For many patients, treatment simply involves using eye drops regularly. This drop helps reduce eye pressure or protect the optic nerve. In some cases, doctor may recommend laser treatment or surgery. These treatments do not remove glaucoma completely, but they help controlling the disease and protect the vision. With proper treatment and regular follow-up, many patients live their entire lives without significant loss of vision. Another important thing people should know is that glaucoma often has a family connection. If someone in your family has glaucoma, your risk of developing the disease becomes higher. So if you know that a parent, sibling, or close relative has glaucoma, it would be wise to get your eye checked regularly. Sometimes one person diagnosis in a family can actually help protect the vision of several other family members. Let me ask you another question. Do you know anyone in your family or neighborhood who has glaucoma? If yes, have you ever considered getting your own eye checked because of that? Sometimes awareness begins with a simple conversation within the family. Now you might wonder how glaucoma is detected. The good news is that glaucoma screening is usually quick and painless. An eye specialist may perform a few simple tests. We measure eye pressure, we examine optic nerve, we may perform a visual field test to check side vision, which we call it perimetry, and sometimes we use advanced OCT imaging tests like OCT optic nerve head to study the nerve in detail. This test allows us to detect glaucoma very slowly, sometimes even before a person notices any vision problem. And that is exactly what we want, because the earlier we detect glaucoma, the better we can protect vision. During this Glaucoma Awareness Week, our goal is simple. We want people to start thinking about their eye health. Talk to your family about glaucoma. Ask your parents if they have ever had their eye pressure checked. Encourage your relatives and friends above the age of 40 to have a comprehensive eye examination. Small actions like this can prevent many causes of blindness. And that brings us back to the message of this campaign, uniting for a world without glaucoma. When doctors, patients, families, communities work together, we move closer to that goal because awareness leads to testing. Testing leads to early diagnosis, and early diagnosis leads to saving vision. So, today, before you go about the rest of your day, I would like you to remember just one simple thought. When was the last time you had your eye checked for glaucoma? If the answer is never, perhaps today is the right time to start with. Perhaps this is the right time to take that step. Your eyes are precious. Please protect them. Thank you very much.
শ্ৰোতাসকলে ইমান পৰে ডাক্তৰ অৰুন্ধতী তামুলীৰ অবজাৰভেন্স অফ ৱৰ্ল্ড গ্ল'কমা উইক শীৰ্ষক কথিকাটি শুনিলে।